Hello everybody, and welcome to the Thursday edition of Video Clips. And today we're going to talk about medical reversals, which are defined as practices that have been found through randomized controlled trials to be no better than, and sometimes even worse than, a previously used standard of care. So a recent analysis of over 3,000 randomized controlled trials published in 3 journals that are considered to be leading journals. That's a subjective term these days, and I'm not sure I consider any of them that. But in any case, these were the Journal of the American Medical Association, the Lancet, and the New England Journal of Medicine, showed that 396, now you heard that right, a lot, of common and routine practices are now mostly contraindicated. The researchers reported that 13% of the 3,000 trials they reviewed resulted in a finding that an existing practice should be categorized as a medical reversal, which really means do much less of it and maybe stop doing it altogether. Now, the highest percentage of the reversals were practices that were commonly used in high-income countries. Now, the authors say, well, maybe one of the reasons for this is that so many randomized controlled trials are conducted in countries like the United States. I'm sure that's true, but my hypothesis is that in wealthier countries, more money is spent on healthcare, and it's done with the assumption that more is always better, which is not necessarily the case. It's almost always not the case, actually. The United States, for example, is in the top tier of spending almost all the time, but many countries that spend a lot less money than we do have much better health outcomes than we have here. In terms of medical categories, cardiology was the most common medical category in terms of uselessness. 20% of the findings were there. Public health and preventive medicine came in second, and critical care was third. In terms of types of interventions deemed useless, 33% for medications, that was the top tier. Second most common was procedures at 20%, and the third was vitamins and supplements. So I'm not going to recite to you all 396, obviously, but I'll pick just a few. Some of you have heard about these things before from me, and others you may not be familiar with, but these are just a few of the things that were deemed useless. Stop doing it. The risk of harm from screening with mammograms is 10 times higher than the risk of benefit, or chance of benefit. There is no evidence that fitness trackers, that wearable fitness type trackers, result in long-term weight loss. In fact, some studies show that people wearing these trackers lose less weight than subjects who don't use them at all. And I have seen other studies that have shown that this is the case. Fish oil does not reduce the risk of any type of cardiovascular disease. Cognitive behavioral therapy is better than sleep medications for insomnia. Ginkgo biloba does not reduce the risk of memory loss or dementia. Keeping the house free of dust mites, mice, and cockroaches does not reduce the risk of asthma attacks. There are some good reasons to do that, but it just isn't going to affect asthma. Physical therapy is as effective as surgery for a torn meniscus. Although 25% of the Medicare population and 74% of VA patients are treated with steroid injections, there's no evidence that the injections reduce pain, improve function, or reduce the likelihood of having surgery. Thigh-length graduated compression stockings don't reduce the risk of deep vein thrombosis after stroke, and vitamin A supplementation is useless for neonates for reducing mortality during the first 6 months of life. So here's what the authors concluded, and I think that their findings are important. Reversals are evidence that independent and non-conflicted funding of clinical research is needed. It is important to test not only new, but also established practices, since many have become routine without randomized controlled trials and high standards of evidence and are not supported by any biological plausibility. There is danger in rushing new treatments into practice because once a useless practice is established and becomes routine, it's difficult to convince healthcare providers to discontinue it, and providers are often resistant. You heard about that last week when I talked about routine urinalysis. We just can't get doctors to stop doing it, so hospitals have to play tricks to keep them from getting the results and over-prescribing antibiotics in response. More attention should be paid to testing new treatments before they become routine in order to reduce the number of reversals and prevent harm to patients. Considerable cost savings and improvement in medical care would result if these 396 practices were stopped. Now, this latest study is just the latest and one of many that have been designed to and projects that have been designed to try to change medical practice so that it's less harmful and more productive for consumers. Another one is the Choosing Wisely campaign, which started in 2012. Its mission is to promote conversations between clinicians and patients by helping patients to choose care that is supported by evidence, that doesn't duplicate other tests and procedures that they've already had, is free from harm and truly necessary. I mean, that should be the standard for anything that goes on in a healthcare practice. The project began by asking members of medical specialties to identify tests and procedures commonly used but which should be questioned and discussed in order to determine usefulness and safety. So I'm going to give you just a few of the recommendations that this group came up with almost 7 8 years ago. But they're still being done. They said this stuff should be discontinued. So here's some things. Don't test women for MTHFR gene mutations. Don't perform pelvic ultrasound to screen for ovarian cancer. Do not routinely recommend restricting activity or bed rest during pregnancy. Don't treat mild dysplasia, cervical dysplasia, in patients who have had it for less than 2 years. Don't screen women older than 65 years of age for cervical cancer who aren't at high risk. Don't recommend ultrasound for incidental thyroid nodules found when looking for something else with CT, MRI, or ultrasound in low-risk patients unless there's something terribly abnormal about the nodule. Don't measure vitamin D levels unless the patient has hypercalcemia or decreased kidney function. Don't give antibiotics to children with sinusitis or bronchitis. Don't recommend rest for people with low back pain. People should remain as active as possible. They'll recover sooner. Don't order x-rays for injured workers with acute back pain. Avoid knee arthroscopy for patients with meniscal tears. Don't use glucosamine and chondroitin for patients with osteoarthritis of the knee. Don't treat low-risk localized prostate cancer. Discuss active surveillance, and don't prescribe testosterone therapy without confirmed laboratory evidence of deficiency. Now, there are hundreds and hundreds of these, and I won't read all of them to you, but between some excerpts from the two lists, I think you start to get the idea that that all areas of medicine are involved. They're all doing useless things. It's not a particular specialty. I mean, it's more prevalent in some specialties like cardiology, but they're all involved in it. And that it's highly likely that if you see doctors and are given advice by doctors, that you're going to be told to do something, either have a test or take a drug or a supplement or die, something that is absolutely useless and potentially quite harmful. The more doctors you see, the more visits you have, the more likely this will to be the case. So in the absence of emergency, the best policy is to do nothing until you have a chance to sort things out. And so we do a lot of wonderful things in medicine, and I think it's important to remember that. We have a lot of wonderful doctors. I hear about them all the time, and it restores my faith in humanity that there are such good doctors out there. And I'm lucky to know a lot of them, and if something, God forbid, happened to me, I would know good people to go to. But the bottom line is we must be continually mindful that interacting with the medical profession is fraught with opportunities to be harmed. And so just look at this as the way you look at being a consumer of anything else. You read, you research, you check things out, and there doesn't have to be any hurry. 99% of the time, whatever you're being advised to do doesn't have to be decided upon today. So become informed. If you're not a member, let us help you do that. All right, that's all for today and all for the week. As usual, pass this on to anybody who you think would enjoy watching it, and I'll be back to you next week with more news.